Balance Center was launched in November of 2013 officially. The idea behind the Balance Center was to provide a service where we can really diagnose and try to identify the causes of dizziness. And this is the first center of its kind in the Middle East, and probably still one of the very few that offers this much of a comprehensive approach to the dizzy patient. The idea behind it is that dizziness is a very prevalent disease. There are a lot of dizzy patients. Dizziness is a very common complaint, especially as we all get older. And it's often difficult to really identify the proper reason for dizziness. Dizzy patients suffer a lot in their everyday life. They have a hard time moving around, they are limited in their activities, they start reducing their social interaction, they have a problem going to work, and they really want a final solution to their problem. With the center here, we have a variety of diagnostic equipment. We have a multidisciplinary team from ear surgeons, otologists, audiologists, balance specialists. We cooperate with the neurology department. We cooperate with the physical therapy department. It is primarily a diagnostic center. We did our best to have the latest in technology to be able to really look at the different components of balance. So usually problems in balance can come from problems with the ear, with the inner ear. Sometimes it's a problem with the muscle, sometimes it's a problem with the vision, and sometimes it's just the interaction of all these different systems. And our technology at the Balance Center allows us to take a look at these different components of balance and determine which one is really causing the trouble for the patient, and therefore develop the treatment accordingly. But we also, of course, giving the diagnosis without the treatment is useless. So we have the specialists, especially ourselves, in terms of otology, and also the support services such as physical therapy or other departments such as neurology that we work with to try to promote the treatment for the specific cause once we find it. The idea from the Balance Center is to have a center where it's almost a one-stop shop. So the patient comes to us, we have a variety of tools that we can use to diagnose the reason for their dizziness. And once we know the cause of the dizziness and the reason behind the dizziness, we can offer them the proper treatment that is most efficient to get them back to their work and their life as fast as possible. Balance Awareness Week is in September, and we're trying to promote the idea that being dizzy or being out of balance or having problems with your equilibrium or your balance is not a fatality. It's not something you just have to live with, like sometimes we hear from patients. They are told that there's nothing we can do, you just have to live with it. And we want to make sure that the message comes across that it's not something you have to live with. There are a lot of things that we can do to help you in your balance. You deserve to be properly, to have your balance back. You deserve to be able to live your life feeling safe. Anytime you feel like you're not your same self, you're not feeling safe, you're not feeling secure walking down the street, doing your exercises, going up the stairs, playing with your children, this is a reason in general to be evaluated for your balance system.